Hello, good evening, everybody. Today we are going exploring a breakthrough in cardiology that is revolutionizing the way we manage coronary artery disease. Drug-coated balloon angioplasty, the topic. I dive directly into the topic today. I will guide you through why this technique is a game changer for both physicians and patients. First, let's refresh our understanding of coronary artery disease. This condition occurs when plaque builds up in the coronary arteries, leading to reduced blood flow to the heart. The traditional approach to treating this involves stenting and bypass surgery. However, drug-coated balloon angioplasty is offering a minimally invasive alternative. Now, exactly what the drug-coated balloon angioplasty means is simply we insert the balloon into the artery. There, we inflate the balloon inside the coronary artery. The difference between the permanent stent and the drug-coated balloon angioplasty is the drug-coated balloon angioplasty is not leaving any material or metal inside that. When we compare a drug-coated stent angioplasty or bypass surgery, within 10 years the risk is very high. The patient may develop more than 50% of the patient may develop complications, sudden stent closure or gradual restenosis, and over the period of time the stent will get completely occluded and it may be difficult to again reopen the implanted stent. The same way in bypass surgery, every bypass graft, the viability and patency of the bypass graft is almost yearly 5 to 7% risk chances of getting the grafted vessel closure. So if you compare both drug-eluting stents and bypass surgery, both the techniques are life-saving technique, but it has lot of complications, and we need to overcome all these complications. We developed the new techniques. It's called drug-coated balloon. See, the drug is simply sprayed on the balloon. One technique that and the balloon is covered with the nanotechnology. The drug is completely applied around the outer layer of the balloon. And sometimes a dipping type balloon coating, and some will have the spray type of balloon coating. But at present, right now, we have the nanotechnology based drug coated balloons are available in the market. The nanotechnology means that drugs will be preserved in the outer surface of the balloon and it makes complete intact. At any cost, the drugs before the implantation, before the inflation, it wouldn't get any dissolution or damages. So that's the reason the nanotechnology of balloon drug coating is very imminent in drug coated balloon angioplasty. So the drug-coated balloon is directly taken into the coronary artery. There we inflate the balloon for 40 to 30 seconds continuously. Before that, what we do generally in general angioplasty, first we check the coronary artery size measurement. The coronary artery size is 3 millimeter or 3.5 millimeter, 2.7 millimeter. First, we measure the diameter of the coronary artery. At the same way, we select the balloon size. Suppose if the balloon coronary artery's diameter is 3 millimeter, we select 3 millimeter balloon. That is normal balloon. Before inflating the drug-coated balloon, first we will inflate with the ordinary balloon inside the coronary artery to give adequate space to enter to allow the drug-coated balloon. So here we follow the formula 1:1:1. That means the first one is natural diameter of the coronary artery. And the second one is we have to select a pre-dilatation balloon. So if it is a 3 millimeter vessel size, 3 meter balloon we have to take. Then again eventually that coated balloon should be 3 millimeters. So 1:1:1. This formula is very important to get the best result from drug coated balloon angioplasty. Currently, at present in the market we have sirolimus eluting balloons and paclitaxel eluting balloons. These drugs are anti-proliferative drugs which has been used in cancer treatment that reacts with smooth muscle cells. By interacting with the smooth muscle cells, because it regresses and reduces the volume of smooth muscle cells, thereby it opens the coronary artery. And while taking the balloon into the coronary, it should be applied within 1 minute. If the operator takes more than 1 minute or 2 minutes, 3 minutes, if they prolong, the drugs will get dissolved outside the coronary artery. Then the patient will not get any benefit of a drug-coated balloon. So this is a very simple technique, but we need to be very careful in the timing. Timing is very important in inflating the drug-coated balloon inside the coronary artery, particularly the culprit area of the lesion. Sometimes untreatable and stenting and bypass surgery, sometimes diffuse disease, multiple lesions and distal lesions. If the lesions block is occluded at the distal edge of the coronary artery, the bypass surgery, CT surgeon cannot able to make any graft near distal to the coronary artery. So in that way, coronary bypass surgery, the surgeon will avoid. But in this technique, a drug-coated balloon angioplasty technique, we can treat any complicated lesion within the limitation, because every treatment has limitation. The drug-coated balloon also has some kind of limitations. A patient with a high risk bleeding, those who have the recent bleeding or history of cerebral bleeding and GI bleeding, gums bleeding, any other bleeding risk, if we keep 2 antiplatelet drugs, especially aspirin clopidogrel or aspirin ticagrelor, or sometimes a patient with arrhythmia, atrial fibrillation, we are supposed to give some anticoagulant along with antiplatelets. In those conditions, patient may have tendency of bleeding. Bleeding is a very high risk. When the patient bleeds, we need patient blood transfusion. Patient may develop a shock, hypotension. Due to shock, patient may develop sepsis, then kidney failure. Lot of organ damages may happen due to bleeding. So that unnecessary bleeding can be stopped by using this technique, drug-coated balloon angioplasty. In kidney failure patients, we cannot, suppose if the patient has kidney failure, if we do angioplasty, again the patient stent may get again close. Even patient with the kidney failure, stent occlusion chances are very high. Suddenly stent will get close. When the stent closes, patient may develop profound heart attack. Even the heart attack in combination with the kidney failure, the patient mortality will be very high. We cannot save the patient. And sometimes even allergic and intolerance to antiplatelets. Some patients, they may be allergic to aspirin. Some people, they may have allergic to or intolerance to ticagrelor or clopidogrel. Recently, European Society of Cardiology, they have approved this treatment for in-stent restenosis, calcific lesion, uncrossable lesion, diffusely diseased lesion, and osteal lesions, small vessels also. But in case of native vessel means if we want to do fresh angioplasty, fresh lesion angioplasty means drug-coated balloon angioplasty, it has lot of researches. Still, it is not in the evidence of 1 and A. But restenosis, stent restenosis, and diffuse disease, osteal lesions, small vessel disease, this is approved by European Society of Cardiology. And I am doing lot of research in native vessel angioplasty with a drug-coated balloon with different kinds of drugs, different kinds of anti-proliferative drugs, particularly everolimus and zatolimus coating balloons also. I am doing a lot of research in other drugs. Right now in the market we have sirolimus eluting balloon and tacrolimus paclitaxel eluting balloons. So this is an example. One patient I have operated. The patient was 73 years old man. He has a triple vessel disease, anterior MI, and you can see circumflex. Anterior here you can see right coronary artery almost 90% disease, left coronary artery LAD 80-90% disease, diagnosed disease. This patient have been advised by bypass surgery. The patient was not willing for bypass surgery or angioplasty. Fearing about that angioplasty, stent may again get blocked and patient may develop again heart attack, sudden heart attack. Because the stented vessel gets closure immediately, the patient comes under high risk. Sudden closure of stent may stop the blood flow inside the coronary artery. By that way, patient may develop cardiogenic shock, cardiac arrest. So in this patient, triple vessel disease, I simply treated all the three vessels with drug-coated balloon angioplasty only. The second day I discharged and I put only one tablet antiplatelets along with statins, simple treatment. So the important benefit of this drug-coated and balloon angioplasty is, if suppose unknowingly the patient skip antiplatelets for like 1 or 2 days, 3 days, nothing will happen. In case of stenting, they cannot skip even one dose of antiplatelets because they have to continue without stop based on their consultant advice. In this drug-coated balloon angioplasty, limited medications and limited period of time, short span of time, antiplatelets can be continued. There won't be major complication even if they stop or if you taper the dose in future also. And this is one more 35 years old young patient. They had a family history of coronary disease, and he came with non-ST elevation, but he came with severe chest pain and he had triple vessel disease. And this triple vessel disease also I have treated only with the drug-coated balloon, because in younger population, if we put stent at the age of 34, he may develop again heart attack before 45 or 50. Because as I said before, the restenosis rate of an stent will be more than 50% for 10 years period of time. Sometimes, some cases, there may be some exception. Some patients, they may do well even after 15 years and 20 years, even bypass surgery also. That is exceptional cases. I am talking about majority of the cases. The patient may develop 50% chances of again reblock in the stent or bypass surgery after 10 years. So to eliminate all these pitfalls and life-threatening complication after angioplasty or bypass surgery, this drug-coated balloon angioplasty gives new lease of life and confidence and fearless lifestyle for everybody. So drugs after drug-coated balloon treatment, as I said before, short time clopidogrel, ticagrelor, and then novel oral anticoagulants can be prescribed, and long time single antiplatelets also possible with the drug-coated balloon. Atorvastatin and rosuvastatin, either one statin can be continued. And sometimes if they have a recurrent chest pain with a small vessel which is like a microvascular angina, we can safely prescribe nitroglycerin, nicorandil or ranolazine molecule to alleviate the chest pain. And other necessary drugs also can be prescribed after drug-coated balloon angioplasty. According to European Society of Cardiology guidelines, they give class 1 and evidence-based category of support for drug-coated balloon angioplasty. That means this drug-coated balloon angioplasty is promising and faith-promoting technique and treatment for everybody. There is no fear of sudden heart attack after drug-coated balloon angioplasty. Sometimes the complication may happen during drug-coated balloon angioplasty. Patient blood vessel may get cracked There may be different types of cracks. If the crack is type A, type B, type 1, type 2, we can neglect the crack, small crack. The major crack, then we supposed to put drug-coated stenting instead of drug-coated balloon. So we need to be very careful. During drug-coated balloon angioplasty, vessel crack, that means a dissection, artery dissection may happen. If the dissection is very mild, we can neglect it. Nothing will happen. Patient will not have any serious complication consequences after procedure. If the crack is moderate or severe crack, like a type 3, type 4 dissection, we need to act immediately and we have to put drug-coated stent in the cracked or dissected region of the coronary artery. This is a very important, this is the only complication we need to be careful. But if the operator is very, if he plans meticulously to do drug-coated balloon angioplasty, this type of complication also can be neglected, can be avoided. Because this dissection of vessel perforation is less than 1% in drug-coated balloon angioplasty. The benefits of drug-coated balloon angioplasty is it relieves obstruction and it leaves nothing. That is the important thing. Because this drug-coated balloon, just it's simply inflating inside the block and we remove the simple balloon and the drug is only localized, the drugs. So it is not leaving any material like metal or stainless steel material or polymer or any plastic material like PVS stent, and is a lower risk of restenosis because there is no material foreign body. Then there cannot be any restenosis in future and less medication burden. By that way, the cost of medication also will come down. The monthly bills of medication also will come down. And a great option for small arteries. If the vessel size is less than 2 millimeter, so drug-coated balloon angioplasty will give immense benefit and promising result, and it eliminate complete chest pain of the patient. The patient, the history of bleeding also, this is a promising treatment, drug-coated balloon angioplasty. So I am doing a lot of research in drug-coated balloon angioplasty, particularly in everolimus coated balloon and zetatimus coated balloon, and I am making researches among the differences between all three drugs: paclitaxel, zetatimus, everolimus, and sirolimus. If there is any superiority or inferiority among the drugs platform. So on that particular research, because I am spending my 50% of the time in research for the treatment, and I have given last 2 years in drug-coated balloon angioplasty, 100% success rate. No patient has developed again vessel closure or heart attack after drug-coated balloon angioplasty. So I am emphasizing this is a very important and promising technique in the coronary artery disease management. Definitely in future it is going to have a new dimension for the treatment of coronary artery disease. I believe even after 5 to 6 years, all the drug-coated stents will go away and bypass surgery level also will come down. So the patient may go home the second day very immediately, even if they undergo angioplasty through the leg vessel. If they undergo angioplasty through the arm vessel, radial artery, they may get discharged even after 2 hours or 3 hours. If they get angioplasty through the femoral artery, femoral artery, left or right femoral artery, they have to stay in the hospital for 1 day. So this is the benefit of drug-coated balloon angioplasty. Thank you for listening, and I request you to subscribe my channels and click the bell icon and click that like button and share this video to your friends, family members, and your family physicians and other medical doctors. So this video is going to be more informative for everybody. I hope so. So I will meet you in the next video. Until then, bye bye. Thank you, everybody. There